This pregnancy's been easier than the others, but I wish I could get this tooth checked out.
What do you mean?
Well, I avoid going to the dentist when I'm pregnant, but this toothache started last week and it's just getting worse.
Why haven't you been to the dentist?
I'm afraid they'll take x-rays, and I heard that x-rays can hurt your baby.
Right. I was nervous about that, too. When I was pregnant with Richard, I got the worst toothache of my life. I was taking all kinds of painkillers, aspirin and stuff.
See, that's the problem. I don't think painkillers are good for the baby either.
Right. I went to my dentist, and he totally put my mind at ease. The dosage of radiation they use in those x-rays is so low, it won't hurt the baby. And they always have you wear that x-ray shield to protect your body.
So you had a cavity filled?
2 of them. They numbed me up. I didn't feel a thing.
Did they use Novocaine? Isn't Novocaine bad for your baby?
No, he told me that won't hurt the baby either. But if you're still feeling worried, you can talk to your dentist. They'll explain it all to you.
I don't know.
Just look, when you make the appointment, tell the dentist about your pain and make sure you tell him how far along you are in the pregnancy. Then you can decide together what to do. You have to take care of yourself to take care of the baby.
Okay. You're probably right. I'll give the dental clinic a call.
It's been great to talk with you today. There's been a lot of confusion about dental health care during pregnancy, and I'm happy to find out about your babies and share some information with you. Any questions?
You mentioned it's important to use fluoride during pregnancy. Can you say more about why?
Sure. Fluoride strengthens your teeth against bacteria that causes tooth decay. It's very good for pregnant women to drink fluoridated water and use toothpaste with fluoride.
Where do you buy fluoride water?
Oh, you don't need to buy expensive bottled water. The tap water in most cities is fluoridated. Just be sure to drink enough of it.
So it's okay to drink tap water?
Sure. In this city, the water is actually fluoridated and a lot cheaper than bottled water.
I'm going to be living with my parents for a few weeks, and I'm not sure if their water has fluoride in it.
That's a good point. Check with the local dentist near your parents' house. He or she should know. Don't forget, fluoride toothpaste is a good way to get fluoride on your teeth and should be used twice daily. And I recommend using a fluoride mouth rinse like this one. Here, these are for you to take home. Just make sure you use them.
Thanks.
Well, good news today. We didn't find any cavities, but we do need to keep an eye on that plaque buildup, okay? So keep brushing after every meal and floss every day.
I always forget to floss.
It's really important. In fact, during pregnancy, you have a higher risk of developing gum disease.
Is that bad breath?
You can get bad breath from gum disease and cavities. Let me show you something. See, the gums and the tissue surrounding the teeth can become inflamed and infected because of a buildup of bacteria or food deposits along the gum ridge. A lot of times you'll get swelling or sensitive gums.
Why does being pregnant make it worse?
Your body is undergoing all kinds of hormonal changes that increase the sensitivity of your gums. So it's even more important that you take care of your teeth and gums during pregnancy in order to prevent gum disease.
So I need to brush and floss more?
Yes, definitely. You should brush at least twice a day and floss before you go to bed. It's important that you keep brushing and flossing even if your gums may bleed a little. And by the way, you should also try to avoid sugar, including pop.
Anything else?
Since we're on the subject, eat a healthy diet, including lots of fruits and vegetables and foods that are high in calcium, like milk or yogurt or dark green vegetables. And if you aren't getting enough of these foods, be sure to take a multivitamin with calcium.
Wow, that's a lot to think about.
I'll send you home with a pamphlet that explains it all.
Thanks.
I'll want to see you again in about 1 month to see how you're doing with brushing and flossing.
Please don't tell me I have to give up soda. It's one of the few vices I have left. I hate to be the one to break the bad news, but soda pop doesn't have any nutritional value, and it's really bad for your teeth. Now, it's especially important to get good nutrition and avoid sugar while you're pregnant.
Well, why especially during pregnancy?
The bacteria in your mouth love sugar as much as you do.
Come on.
It's true. The bacteria that live in your teeth feed on the sugar that you eat and produces an acid that causes cavities. When the bacteria builds up, it's called plaque, and that can lead to gum disease, which if you don't get it treated, can cause you to lose your teeth.
I don't want that.
No. But you can avoid it by eating a healthy diet, like more fruits and vegetables. A healthy diet's not only good for your teeth, but your overall health and your baby's health.
So you're saying my mouth can affect my baby?
Most people don't realize that bacteria in the mom's mouth can get passed on to the baby after it's born. So keeping your own teeth in good shape will prevent your baby from getting tooth decay.
Well, if it's going to keep my baby healthy, I guess it's worth giving up soda pop.
Remember that your baby's teeth are already being formed while he or she is in the womb. So it's important to get enough calcium to strengthen your own teeth and bones, and your baby's teeth and bones.
So, like drink milk?
Some good sources of calcium are milk, cheese, dark green vegetables, and sardines with their bones.
Oh.
Now, if you have any trouble digesting any of these foods, you should take calcium supplements during your pregnancy and while you're nursing your baby.
Okay, I guess that makes sense. I mean, I have to start eating right sometime in my life.
intaa waxaa inoogu dhan cajaladii qaybtiida hore qaybta labaadna dib baynu ka daawan doonaa laakiin muhiimaddu waxa weeyaan annagu haddaynu nahay Soomaali caafimaadka annagoo sidiisaba horta runtii ilaalintiisa ay nagu adag tahay baa haddana qaybtan la yiraahdo oral health ama caafimaadka ilkaha ayaa waxay tahayba qayb runtii aanba inoo tirsanayn hadday hooyada uur leedahayna kaba sii daran iyo ilmaha yaryarka ah marka arrintan waa wacyigelin aan doonayo in dadka iyagu ay ila maqlaan ila arkaan dabadeedna aynu ka wada hadalno sida aynu ka yeeli lahayn caafimaadka nafteenna caafimaadka ilkaheena maca salaama